You watched me grow my gynecomastia tissue to legendary Austin Powers fembot proportions, measuring approximately 2 inches across on both sides. Now join me for the post-operation recovery protocol, where we're going to discuss everything that I'm doing to heal from the surgery as fast as possible and get these pectorals looking nice and juicy again. Rated R for graphic content. Vigorous Steve here. Right now I'm exactly 2 weeks post-operation from the gynecomastia surgery in the liposuction that I did at the exact same time, removing some stubborn adipose tissue on the lower chest. So I feel it's time for an update and give you guys some insights on how my recovery is going. Be forewarned, this video will contain graphic content from the surgery, so I wouldn't watch this video if you just finished a meal, or you're right before a meal, or you're on a hefty dose of a GLP-1 receptor agonist. I had some caution is advised. Now, I've explained my reasoning for growing my gynecomastia tissue to the nth degree in the previous Operation Gynecomastia videos, which I've also linked down below. This is part 4, and there might even be a part 5 when I give you guys a full update a couple months down the line when everything is nicely healed and we can do a proper before and after. As a quick reminder, I developed gynecomastia shortly after my motorcycle accident when I was up and running and going back to the gym again. At that time, I didn't take any performance-enhancing drugs, I didn't smoke any weed, I abstained from alcohol, so that can be the underlying cause for developing gynecomastia. And again, I wasn't taking kinds of medications like SSRIs or beta blockers that are also known to grow gynecomastia. So I suspect that I was undergoing some sort of hormonal roller coaster, going from peak natty shape to bedridden to slowly making my way back up to the gym again. And then at one point, a couple months into going back to the gym, I touched my right nipple because it was a little bit sore and a little bit tender, and I had developed full-blown gynecomastia, which I actually got diagnosed at the hospital with an ultrasound, where they asked me if I was taking steroids, which again, at the time, I was not. I developed gynecomastia when I was 24 years old, and I first took steroids when I was 26 years old. During my first cycle, the gynecomastia actually got smaller because I was controlling my serum estradiol levels with a anastrozole. And then over the years, when I started experimenting with other anabolic androgenic steroids and performance-enhancing drugs, nandrolone particularly, the gyno on the right side got bigger and bigger, and I even developed it on the left side until I learned how to control that a little bit more properly. The last couple of years, I tried to shrink the gynecomastia with roloxifene, taking dosages up to 120 milligrams daily. I even made a video about that. It's linked down below in case you're interested. But the roloxifene therapy only shrank the gynecomastia by about 50%. And that effect went away, meaning that the gynecomastia came back to its original size a couple of months after I discontinued the roloxifene. So that was only a temporary effect. And I got the similar effect from taking mastrone or primobolan at reasonably higher dosages beyond 300 milligrams weekly, which would also shrink the gynecomastia tissue by approximately 50%. So I would always take that on cycle when I was trying to get lean and get this entire the pectoral area looking nice and juicy and detailed without gyno or minimal gyno and minimal body fat levels. Now, in my case, my gynecomastia tissue was never visible, not in pictures, not through a shirt during the off-season or cutting phases. It didn't really protrude, luckily, but that's also because I always had a little bit of adipose tissue in the lower chest that never, ever, ever went away. No matter how much selective estrogen receptor modulators I took, no matter how low I crushed my serum estradiol levels, or how many DHT derivatives I took, right? At one point, it would get a little bit less and a little bit flabby and watery, but still blurry, hiding the definition underneath of the chest muscle, still hiding the gynecomastia tissue, which was present and noticeable by the touch, but not clearly visible. And then up until one point when I got below 6% body fat, all of my body parts started to disappear and the fat didn't really go away. So yeah, I took the easy way out and decided for liposuction after dieting multiple times between the age of 15 and 41 years old. Now, for the gynecomastia surgery and the liposuction, there's an expected 2-week recovery process where you can go back to the gym. I mean, I'm now 2 weeks post-operation and I feel large in charge, ready to go back to the gym. But since I knew I was going to be incapacitated for a couple of weeks and not training at the highest training capacity, I mean, it still feels a little bit tender. I wouldn't be able to do PRs on chest or shoulder day or tricep day for that matter. I figured might as well do LASIK eye surgery at the same time because I was getting really tired of wearing glasses and I wanted to get the plate in my leg removed, which has been there since May 2007, since the motorcycle accident. That's close to 18 years. And the added downtime wouldn't be that much longer. Also because I'm about to be a father in the middle of this year, and I wouldn't be able to have this level of downtime during that time when my wife is taking care of me and my child. Right? It wouldn't be responsible as a parent, so I'm just getting it done now. And then by the time my kid is born, I'm fully operational. So after doing a lot of research, speaking to my friends in the bodybuilding community here in Thailand who have also done gynecomastia surgery, and some recommendations of my wife's personal training clients, I decided to do the gynecomastia surgery at Ratinan Medical Center with Dr. Aniwat Nilakarn, the femto Lasik eye surgery at Param 9 Hospital with Dr. Chayata Liam Sirajarun, and the orthopedic plate and screw removal surgery also at Param 9 Hospital with Dr. Natavut Paisinsom Boon. You can find the links down below. My sincere apologies if I butchered your names. I've been in Thailand for a very long time, but pronouncing the names here in Thailand, still a little bit tricky. Anyway, the links for all of these doctors and hospitals are down below. I'm very happy with their services and aftercare so far. So if you're thinking about medical tourism to Thailand, or you live in Thailand thinking about similar surgeries, operations, or medical procedures, my recommendations are down below. So I ended up doing 4 medical procedures in 10 days with additional hospital visits for checkups. So I've been in and out of the hospital for the last 2 weeks, doing liposuction and gynecomastia surgery and femto Lasik eye surgery and orthopedic leg surgery with a total of 7 incisions, 1, 2, 3, 4, 5, 6, 7, the one on my leg, with a combined length of about 19 centimeters or 7.5 inches. And those are not the inches that you're looking for. So it's been one hell of a roller coaster, and I'm happy to say that I probably don't have to go to the hospital anytime soon unless I decide to go with veneers. So here's the steroid cycle that I ended up with while eating around 4,600 to 5,000 calories daily in an attempt to grow the gynecomastia tissue and add additional body fat in the adipose tissue on my lower chest for the maximum amount of liposuction and make it all look tidy post-op. So I was taking testosterone enanthate, 500 milligrams weekly, nandrolone decanoate, 500 milligrams weekly, tristellone acetate, 150 milligrams weekly. Then I took 200 milligrams anadrol, 50 milligrams pre-workout, combined with YK11, let's say 30 milligrams daily, so that's 210 milligrams weekly. And I would take the anadrol and YK11 sublingually only, spitting out the remainder to initiate the minimal amount of liver stress. Now, YK11 might have acted as an aromatase inhibitor, no scientific evidence to back that up, but anecdotally, based on my blood work and what I read on the steroid cycle reports, that serum estradiol levels are a little bit lower while using YK11. So my total weekly steroid intake was 1,560 milligrams per week, and then I would take DHEA and HCG, which could have also contributed to the gynecomastia formation. But during this entire cycle, my serum estradiol levels was only 100 to 110 picograms per milliliter. And at that time, I was also using 10 IUs to 20 IUs growth hormone, the generic growth hormone being, a few times per week, and even 1,000 micrograms pharmaceutical IGF-1 branded as Increlex pre-workout, and that might have also contributed to the growth of the gynecomastia tissue. Now keep in mind that growth hormone has a similar amino acid structure as prolactin, albeit with a very low relative binding affinity compared to prolactin for the prolactin receptor. But when growth hormone intake is 10 to 20 IUs per day, combined with IGF-1 not using an aromatase inhibitor, serum estradiol levels being allowed to run rampant, and then a good amount of progestogenic 19-orthotestosterone derivatives, ideal scenario for gynecomastia tissue growth, especially considering I was also in a steep caloric surplus. So needless to say, on that protocol, my nipples ended up being pretty sensitive. And then around 1 month before the scheduled surgeries, I switched to the following protocol: testosterone enanthate 300 milligrams per week and testosterone propionate 200 milligrams per week. So I dropped the nandrolone, the tristellone, the YK11, and the anadrol, not using an aromatase inhibitor still. And the weekly steroid intake ended up being 500 milligrams, again, per week. Also taking DHEA, but I didn't take Ovitrol, HCG, I didn't take generic GH or Increlex IGF-1. And without the YK11, in that context, this cycle of only 500 milligrams a test plus DHEA on top of that, Without an aromatase inhibitor, serum estradiol was 130 picograms per milliliter, but I did not notice that my gynecomastia tissue grew much more beyond the Operation Gyno cycle that I was on for, let's say, 2 to 3 months. So as soon as I finished the gyno surgery in preparation for the femto Lasik eye surgery and the orthopedic leg surgery, I dropped down to a generous TRT plus dose for bodybuilders with Anavar on top, obviously, for collagen synthesis. So my Operation Gyno recovery protocol was as follows. Bayer testosterone, I had 1 ampule per week, so that's a total of, let's say, 312.5 milligrams per week, because the Bayer testosterone ampules are generally overfilled at a concentration of 250 milligrams per 1 milliliter. So that's, let's say, 0.6 milliliters intramuscularly Monday, Friday. And by the research Bonnevard, good old oxandrolone, close to pharmaceutical grade. And that's probably the last body research Bonnevard that's in existence, because when it was close to selling out, I bought the remainder of the stock. Don't ask me, that's all mine. My sincere apologies, not. Okay, taking 10 milligrams sublingually upon morning and evening, and that's a total of 20 milligrams daily or 140 milligrams weekly for a total weekly steroid intake of 452.5 milligrams. Quite a lot for somebody who's not actually going to the gym and probably won't go to the gym for a while because the leg surgery is still a bit wishy-washy, a lot of inflammation, and I don't feel comfortable to walk. We'll get into that a little bit later on. But yeah, it's tremendously helping with recovery. I will tell you that. And besides that, it's the same DHA intake that I always take, 37.5 milligrams daily, bringing me to the top of the reference range. Now, during this time of recovery, since estradiol contributes to wound healing and collagen synthesis, I'm still not taking an aromatase inhibitor. So based on this cycle, I would say that my serum estradiol levels are about 75 to 80 picograms per milliliter. Let's say close to half compared to the previous blood work results. But I'll confirm that, let's say, at the end of March, when I expect to conclude this entire recovery protocol and maybe proceed and do some YK11 experiments, or at least follistatin experiments. I'll do blood work before and after, don't worry. But right now, I suspect that my serum estradiol is still, let's say, 50% over the reference range. Besides that, I'm also taking micronized progesterone, 100 milligrams before bed, 3 times weekly. And I might increase that to 100 milligrams every single day. But for now, 300 milligrams weekly, based on the last 2 weeks that my wounds are recovering and healing, I would say this is enough. I couldn't find any conclusive evidence for the ideal dose of microdose progesterone, which helps to regulate inflammation, enhances fibroblast activity, and promotes the deposition of collagen, which are all essential for wound healing after all. So again, I started with 100 milligrams micronized progesterone 3 times weekly to see how wound healing would progress, which again, I'm happy with. So I didn't see a reason to increase to 100 milligrams daily. Oral micronized progesterone is commonly prescribed at 100 milligrams to 200 milligrams per day, usually before bed, because at these dosages, it can make you a little bit sleepy and lethargic and even drowsy, close to a GHB-like effect. Right? My sleep quality right now is absolutely superb, I will tell you. But at these dosages of 100 milligrams to 200 milligrams daily, that's prescribed for hormonal therapy or postmenopausal women or pregnancy protocols, which again, I have a pending video about. Stay tuned. For the peptides that I was using for the Operation Gyno recovery protocol, I switched from generic GH to pharmaceutical GH. I got a little bit excited and started with 5 IU sub-Q before bed, which after 4 days, as you will see from the day-by-day update videos following the gynecomastia surgery, I got increasingly bloated and my ankles were covered in edema. So I dropped down to 2.5 IUs sub-Q before bed, and I've remained at that dosage ever since, using pharmaceutical Merck Serono Sison recombinant growth hormone. Besides that, MA, abbreviations galore, because, well, YouTube is not too keen on peptide websites, but you guys can figure it out. I'm sure about it. Let's see, 500 micrograms TB-500 morning and evening, subcutaneous, for a total of 1,000 micrograms daily. The vials are 10 milligrams, so I reconstitute 2 milliliters of bacteriostatic water in there. So the injection volume is the same across all healing peptides. MA BPC-157, again, 500 micrograms sub-Q in the morning and evening. And I'm zippering all of those injections around the nipple site, which recovered incredibly fast. So I'm just doing the injections around this TB-500 here in the morning and then in the evening on the other side, and then BPC-157 in the morning and then the evening on the other side, right? Just zippering all them down and just spacing the injections out for the maximum coverage of these healing peptides. Besides that, I take MA GHK copper for a synthetic or systemic collagen synthesis, 5 milligrams sub-Q morning and evening for a total of 10 milligrams daily. I'm switching that all around my body because every time I inject GHK copper, I get a little bit of adhesion and the post-injection pain is absolutely horrendous, but it's well worth it, right? Even my skin texture has improved a little bit. I feel that my hair quality has improved. So I'm getting systemic collagen synthesis, including at the incision sites and where all the procedures took place. And I feel that the collagen, the GHK copper has really promoted the wound healing through collagen synthesis increase. And then I take MSD Januvia, 50 milligrams sitagliptin, morning and evening to prevent the breakdown of TB-500 and BPC-157. Sitagliptin, aka Januvia, is a dipeptidyl peptidase 4 inhibitor. These enzymes, the DPP-4 enzymes, break down growth factors like insulin, erythropoietin, IGF-1, right? Insulin like growth factor, growth hormone releasing hormone, but not the actual growth hormone, and other growth factors, including TB-500 and BPC-157. When I was researching TB-500, thymosin beta-4, and BPC-157, I realized that they were being broken down by the DPP-4 enzymes. So technically, based on basic human biology, by combining a dipeptidyl peptidase 4 inhibitor with these healing peptides, you should be able to extend their half-life and their active life. Now, the half-life and the active life hasn't really been established in humans, at least not for TB-500 and BPC-157, even though the thymosin beta-4 literature is very extensive, but we're not entirely sure how much of that translates into the active life and half-life of TB-500 because there's only 5 studies, whereas there's about 190 studies on BPC-157. So I'm combining these healing peptides with the DPP-4 enzyme inhibitor. And I would say that the recovery process so far, right, with the micronized progesterone, the Anavar, and the GHK copper, absolutely stellar. For collagen synthesis, I'm taking the following supplements: Grillamine collagen peptides, right? The details are on the screen. I take 1 scoop with meals 4 times daily. So that's a total of 360 milligrams vitamin C, 480 milligrams hyaluronic acid, almost 50 grams of collagen type 1 and 2, and 320 milligrams collagen type 2 daily, right? For collagen synthesis, performance-enhancing drugs to work, you need the building blocks. And even though the large majority of this breaks down in the intestinal tract, you'll still have adequate amounts of glycine at the same time coming in compared to all of the amino acids and maybe the tripeptides that are not being broken down fully for collagen synthesis to be completely optimized, especially when you combine that with vitamin C, which helps with collagen deposition. So besides the 360 milligrams of vitamin C that I get from the Grillamine collagen peptides supplement spaced out over 4 servings of the day, I take an additional 1,000 milligrams vitamin C 5 times per day for a total of 5,000 milligrams vitamin C from supplements. So that's a total of 5,360 milligrams vitamin C over the day, excluding dietary vitamin C intake. Should be more than enough. And again, antioxidants help with wound healing tremendously. And I choose American Health Vitamin C Ester C because it also contains calcium, and the calcium helps with bone mineralization for the leg surgery. We'll get into that a little bit later on. So while we're at it, I also added these supplements to help with the recovery from the Lasik eye surgery and the orthopedic leg surgery. For the Lasik eye surgery, I added in California Gold Nutrition, lutein, and zeaxanthin, 1 capsule in the morning or with breakfast and dinner for a total of 40 milligrams lutein and 2 milligrams zeaxanthin daily. So I'll keep that in for the next couple of months. Let's see if that improves my eyesight even further. And for the orthopedic leg surgery, I doubled my Gero Formulas K Right, which contains 2,000 IUs vitamin D3, 500 micrograms vitamin K1, 1,500 micrograms vitamin K2, MK4, and 180 micrograms vitamin K, MK7. So I take 1 capsule with breakfast and now also with dinner for a total of 4,000 IUs vitamin D3 and 4,360 micrograms vitamin K daily. On top of that, I also doubled my vitamin D3 intake from 5,000 IUs to 10,000 IUs daily. So I get a total of 14,000 IUs vitamin D3 daily, and I will continue that until I'm fully recovered from the leg surgery. So this is basically just a doubling of my regular supplementation that I was already on to help with mineral deposition in bones. I already get more than enough calcium and magnesium and phosphorus from my diet to help with bone mineralization. And I get more than enough antioxidants and omega-3s for wound healing. In case you're wondering, this is my entire supplementation stack. Let's take a few moments to let that scroll. Right? Gorilla Mind Elite Multivitamin, Now Foods B50 Complex, American Health Vitamin C, which I already mentioned earlier, California Gold Nutrition Vitamin D3, Life Extension Vitamin E, Gero's Formulas K Right, which I also mentioned, California Gold Nutrition Magnesium Glycinate, up to 1,000 milligrams daily, California Gold Nutrition Zinc L-Carnosine Complex to help with digestion because I'm still dealing with some digestive issues. Now Foods Taurine, double strength with every single meal. Gorilla Mind Calcium Beta-hydroxy beta-methylbutyrate, which also contains calcium. So that's additional calcium intake alongside the vitamin C, ester C, and whatever I get from my diet. And that really helped to prevent muscle loss while I'm not going to the gym, alongside the steroids that I'm taking, obviously. Taking nicotinamide mononucleotide and acetylcysteine. I occasionally take injectable glutathione, but I haven't been really on top of that because I wanted to see how the wound healing would progress without the injectable glutathione because, well, the post-injection pain is kind of brutal. Gorilla Mind Omega-3 Elixir Fish Oil, right? Serving with every meal. Again, the lutein and zeaxanthin from California Gold Nutrition. I take citrus bergamot from Gorilla Mind to keep my lipids in range. I take berberine once weekly on Sundays to help with the cheat meals that I'm having, which are now severely limited because I did a food allergy test and basically all the good stuff I can't eat. So I might skip the berberine on Sunday because I'm eating a little bit more cleanly. The curcumin C3 complex I will reintroduce soon because, again, curcumin C3 complex is known to lower IGF-1 levels. And since I'm not supplementing with that, I decided to bring IGF-1 levels as high as possible by taking the curcumin C3 complex out and taking a dipeptidase 4 inhibitor, which prevents the breakdown of IGF-1. So once I'm off that healing stack, I'll reintroduce the curcumin C3 complex, Gorilla Mind astragalus root extract for kidney health, blackcurrant oil double strength morning and evening for overall skin texture and hair growth and youthful appearance, so to say. Ubiquinol, pyrroliquinoline, PQQ, Tatka, oregano oil to help with digestion, and Gorilla Mode Dream or Now Foods Melatonin as needed, which I haven't really needed since I started the oral micronized progesterone. I mean, you sleep like a baby and you're drooling a little bit. So cute. All right, after leg surgery, I also added in more healing peptides to heal or help heal this gigantic, let's say 15 centimeter, 6-inch incision that I have on my right shin. So I doubled the TB-500 and the BPC-157. I'm injecting there locally as well to help with wound healing. I only had a little bit of leakage for one day, and now it seems that it's completely closed. But I have a follow-up appointment another week from now when they're going to remove all of the bandages and clean it up so we can see what the incision actually looks like. It's now completely covered with a surgical bandage, basically. So I went from, after the leg surgery, I went from 1,000 micrograms TB-500 daily to 2,000 micrograms, and the same for BPC-157, administering it here around the gynecomastia site as well as on my leg site. Okay, enough about the protocols and the overall drug talk. Let's move over to how things were looking before and after the surgery, because I took videos day by day discussing the preparation of the surgery, the actual gynecomastia surgery and the liposuction, which took place at the exact same time, and how the recovery was going day by day, give or take, right? I also took a good amount of progress pictures so you could see how the bruising and the inflammation is slowly getting worse and then going away, right? It's going to be a fun segment. Just keep in mind that I didn't use these high quality Shure mic because it's getting away of these juicy pecs. So instead, I used the directional Rode Video NTG microphone, which I used in the past. So the audio quality might be a little bit off. You're just going to have to deal with it while all of this graphic imagery is being served to you on a silver platter. All right, so this is a quick before the gynecomastia surgery gyno check. My sincere apologies for the dad bod. I've been going on a holiday, eating whenever I want, and haven't really been training since then because I wanted to save recovery capability for the surgery that's taking place a couple hours from now. So this on the left side, I have a good amount of body fat, same as on the right side. good amount of body fat. I never got that really away while I was dieting, unless I really wanted to sacrifice my quad and my back size. So I never really got to a point where I was shredded completely top to bottom. I always had a little bit of stubborn body fat here and on the other side as well. Now, this is the actual gynecomastia tissue. I would say that the growing of the gynecomastia tissue on both sides, albeit more on the right side and then on the left side, was a success, letting my estrogen levels run rampant with testosterone, androgen, testosterone, etc., without the use of an aromatase inhibitor. So it's, I would say, about 50% bigger than it was before. So I would say mission accomplished. This is what we have now. They're going to go in through the armpit here to do some liposuction on this area, and as well in this area, obviously, to make it nice and symmetrical. So hopefully they can get it to about a thickness as this. I mean, this is the normal body fat on my chest. You still can see some striations, but obviously here on the bottom, as well as here on the bottom, there's a good amount of fat that I want to remove with liposuction. So they'll do the liposuction first, go in through the armpits, remove this entire area, and then go underneath the nipple to remove the breast tissue, right, both sides, and get that removed. Then I'll wear a gigantic corset for the next couple of days to kind of get the inflammation down and make sure that all of the skin retracts. So this is what my chest looks like before the gynecomastia surgery. Let's do a quick last front double bicep for you guys so you can see what it looks like before the surgery with the gynecomastia tissue and with all of the fat mass at my lower chest. And then hopefully, fingers crossed, or double fingers crossed, it's going to look nice and aesthetic after the surgery. Let's check in a couple of days and then in a couple of weeks to see how the recovery process is going. So I wanted to record this video yesterday right after surgery, but it turns out they gave me a systemic painkiller in the form of fentanyl. So I was a little bit out of it. I didn't have any pain, obviously, but I was not really in the right mood and the right mindset, the right capacity to record a YouTube video right after surgery. So here we are about 20 hours after the surgery took place. We finished about 6 p.m. yesterday, and now I'm going to kind of guide you through the process of what happened with my gynecomastia tissue surgery, even though it looks like I got a breast augmentation. So maybe this was not the gynecomastia surgery I was looking for. All in all, everything was great. It was a great success, I would say. When I arrived at the clinic, we first discussed with the doctor what the strategy was going to be while doing a little bit of additional ultrasound to see if the gynecomastia tissue or the fat tissue had any changes between the intake conversation we had a couple of weeks ago and yesterday where the surgery took place. So we did an ultrasound to kind of see how the tissue, the gynecomastia tissue and the adipose tissue looked to make a strategy. They highlighted everything with a marker just to make sure that that was going to be the area where they performed liposuction on, and then additional marker where the incision for the actual gynecomastia tissue surgery was going to be. When I arrived in the surgery room, I had to lay down with my arms wide, which I can't do right now because I have stitches on the side of my chest. So arms went out wide like a T shape. I had a localized port for the anesthesia placed in, and then basically everything was taped off with medical sheet. So I couldn't really see what was going on. The only thing that was really exposed was my chest, so they could perform surgery there. So I couldn't see what was going on. So based on what I could hear and what I could feel, first I got the systemic anesthesia, again, fentanyl. I told them, don't give me too much. I'd rather take a lower dose than a higher dose based on my body weight. I'd rather feel the pain than go away sleeping. I wanted to be present for the surgery. Then they applied localized anesthesia with, I suspect, insulin syringes zippering up and down, basically where the liposuction was going to take place. Then they made an incision here right in my armpit on both sides. And then they went in with another needle, which was significantly longer. Again, I'm suspecting this based on what I could feel and hear, translating the Thai into English with my limited understanding of Thai language. Very scary, it sounds right now, but I felt I was in good hands. So they went in with another needle to kind of put localized anesthesia at the fat tissue and surrounding the gynecomastia tissue, again, on both sides. They let that sit for about 5 to 10 minutes. Then that area was completely numb, very numb, right? You could still feel pressure to the touch, but pain, nothing whatsoever, right? I felt zero pain the entire way through. Then later they went in through the armpit with the liposuction machine, which, well, basically sounded like a jackhammer. That was quite intense. I'm not going to lie. I'm like, what the hell are you doing inside? So Yeah, it makes quite a substantial noise, I would say. I'm not entirely sure how this machine works, but I'll see if I can overlay some medical equipment, assuming this is the exact same medical equipment that they used for the liposuction. So they did that twice. They went in the first time to kind of clean it up from a bulk perspective. And then later on, I'm not sure, again, if this is the same tool or a different tool, even though it sounded exactly the same, to kind of make sure that everything was uniform. They really put extra special time to kind of make sure that all of the adipose tissue and the fat and the skin was all the same thickness, basically, from the top chest to the bottom chest, and comparing that to my abs. So it would look cosmetically appealing after the surgery is done and I'm fully recovered in a couple of weeks from now. So they did that on both sides. It took quite a long time, I think 1.5 hours to get that liposuction done. Again, a lot of attention to detail to make sure that everything was of a homogeneous thickness when they were done. Then they made the incision at the bottom of the nipple tissue. They removed the right tissue first because it was bigger. So that took them a little bit extra time. And then they went in to remove potential gynecomastia gland tissue to make sure that everything, that there was no possibility of the gynecomastia returning in the future. They did that on the left side as well. Then they stitched all of that up, and I got this beautiful garment with a lot of gauze and padding just to make sure that the inflammation was non-existent. Now, you see here that, of course, this is where the incisions are. These are not underneath the garment. So there's a little bit of inflammation and water retention there on both sides. Obviously, wearing something like this when you had surgery in this entire chest area, it makes it impossible to sleep. So it took me quite a long time to fall asleep last night, but I was able to get about 6-7 hours in over the night, which I think is enough. And then today, actually about an hour from now, I'm going to go to the clinic again to have this removed, see what the damage is or how good it looks after removing all of that fat and gynecomastia tissue, and then see what the next step is going to be, right? So I'll probably get a replacement garment of this, which is super tight and very uncomfortable, but, well, that's what it's going to be to get everything retracted nice and tight once the surgery, once I'm fully recovered from the surgery. So we're going to clean that up today, see if there's any mishaps, to see if everything is going well, just a routine checkup. So for now, because I got incisions on both sides of my chest, I can't really raise my arms more than this, just to make sure that the stitches are not coming loose and that the wound is opening up again, right? I need about a week or 2 weeks, maybe a little bit faster because I'm on the full stack of peptides, obviously. I need at least a couple of days for all of this to heal up and kind of tighten back and grow back together. All right, so this is day number 2 after the gynecomastia surgery. Yesterday, I went back to the clinic to remove all of the gauze and the bandages and clean up all of the incisions in the armpits and below the nipples and make sure that the inflammation and the bruising wasn't too severe. Everything is going according to plan as of now. So they removed the crazy packaging that I had yesterday to apply extra compression, going from a D cup to a C cup now. So instead of bandages, I have a little bit of sponge tissue, which is a little bit easier to maneuver. So that applies extra pressure underneath this compression garment to make sure that the inflammation and the swelling stays minimal and that all of the skin can reattach. Because again, I did quite extensive liposuction all around the lower breast area. So this is what it looks like now. This is a lot more comfortable and a little bit less intrusive than what it looked like yesterday. Still, it looks a little bit weird. Like from the side, you can see that there's a significant amount of chest tissue. Let me remove this chair. You see, chest is like twice the size. And if I wear a t-shirt over this, it's very clear that I'm wearing something underneath because it's sticking out, so let's say 1/2 inch, close, well, a little bit over 1 centimeter. And this is what it looks like without the compression garment. You can see here on my lower chest, I have a little bit of black and blue, some hematomas. I mean, that's meant to be expected after major surgery. The incisions underneath both nipples are about close to 1 inch, let's say 2 centimeters on both sides. So they did a great job keeping the incision size very small for the amount of gynecomastia tissue that they removed. Again, on the right side, it was a lot bigger than on the left side. And the incisions in my armpits, I would say are 1/2 inch, let's say close to 1.5 centimeters on both sides, again, from the point where they did liposuction. So I would say that the incisions, again, very, very small. I expect minimal scarring once everything is healed up, nice and dandy with my extensive healing protocol that I'm on, obviously. I just took a shower. I was able to cut my own hair, shave a little bit, so I don't feel too immobile, right? I can completely shower my entire body using these waterproof bandages. I removed the waterproof bandages after the shower to make them a little bit easier to be removed because, again, the adhesive is quite strong, I would say. So a little bit of water allows you to pull these waterproof bandages off a little bit easier on both sides. And then I washed that area with normal saline solution, applied a little bit of betadine. And then now there are new bandages, which, again, I will remove tomorrow and then clean up again. I believe that the stitches are going to be removed at the 7th day after the surgery. So that's, let's say, 5 days from now. And then I can show you what it looks like. Hopefully by the time all of this inflammation and swelling will be significantly less. By the time I can show you what the incisions look like and to give you guys a little bit of a close-up in case you're interested, right? Close-up of the nipples. Might as well go for that in this video series as well. So for now, the swelling is a lot less than yesterday, I would say, but it's still quite present. So if I flex my chest slightly, you see that there's no separation in the bottom chest. Fingers crossed, that will slowly return over the next couple of weeks. I remember from my wife's breast augmentations that it took her, let's say, 3 to 4 weeks before all of the swelling and the water retention dissipated. And then you can see a clear, nice outline of the chest muscle and the silicone, which was placed within. So I didn't get any silicone, obviously, but the swelling is pretty brutal just the same. Some hematomas underneath. Hopefully over the next couple of weeks it goes away. But for now, what I'm going to do is I'm just going to do daily update videos for you guys so you can see how the swelling kind of shrinks. Again, fingers crossed over the next couple of days. And then once the stitches are removed, we'll go a little bit more in depth. And this is day 13 after the operation. As you can see, I have full mobility and most of the bruising and the hematomas and all that black and blue and purple and whatever color comes after the surgery, that's mostly gone. I still have a little bit of hair on my upper abs, lower chest, and in my armpits, it's, well, mostly gone, luckily. The waterproof bandages were giving me a little bit of issue, not here around the nipple area, but definitely in the armpit. So here it's a little bit red and tender and that kind of stuff. So that was a little bit annoying, something you have to deal with, obviously, after surgery, using waterproof bandages to prevent a tap water to get into the surgery site and potentially cause an infection. So far so good. No infections took place. Everything is healing nice and properly. I don't have any mobility issues. I should be able to go back to the gym, but I want to just give you guys a little bit of an update before I start training again, so you see how much this chest muscle deflated over the last 2 weeks that I didn't train. Actually, I haven't trained for 6 weeks now. So that's why the dad bod is still going strong, but we're working on that. Don't worry. We're going to look progressively better going forward. So there's a little bit of scar tissue on this lower area. There were some adhesions on this side. Maybe you can see it here. There's an adhesion here. That is scar tissue. So I'm not entirely sure if that's a keloid or that's just something that's going to dissolve over time. I'll give that a week or two. And otherwise, I'll do some microneedling and Graston technique on that area. I'll give this a week or two as well. And then I might do some Graston technique to remove the scar tissue on my lower chest. Again, that has nothing to do with the gynecomastia surgery, but that's mostly from the liposuction. So right now, when I flex my chest, you still don't see so much definition on my lower chest, unfortunately. I got a little bit more definition here on this side, but here on the lower chest and definitely here on this side, again, where most of the liposuction took place, I still can't see the definition because there's scar tissue. That injury site is still healing. So I'm going to give that some time. The nipples are all going well. This right nipple turned a little bit black the first couple of days, but then that progressively started to get better. I read on Reddit many other gynecomastia surgery reports that initially one of the nipples or maybe even two nipples might turn black from a little bit of the fluid from the surgery, and a little bit of blood from the surgery is just leaking through the nipples, turning it black. And I had a little bit of discharge the first couple of days. Now that's resolved. So all these funny things you don't really think about until they happen to you after the surgery. And I was in full contact with my clinic just every single day to give them a little bit of an update. And then every couple of days I would go in there to kind of see if everything is going according to plan. And right now it looks absolutely good. So this nipple was a little bit black for the first couple of days. And now at day 13, it's finally turning a normal color again, even though I have a little bit of scabbing and stuff. But that could also be from the discharge coming from the fluids underneath the nipples, right? Making their way out somehow, some way. So I'm cleaning everything every single day, right? My wife is helping me a lot with that, applying a normal saline solution to clean the area on both nipples and the incision sites here. And then we take the pictures, which you just saw, the progress pictures from day 5 to 13. And then we apply a little bit of betadine on the incision sites and put waterproof bandages on it for the next 24 hours. During the time that I was going in for Lasik eye surgery and the leg surgery, removing the orthopedic plate, obviously I couldn't remove the bandages and clean the incision sites of the gynecomastia and the liposuction every single day, but at least every 36 hours, I cleaned the area and applied new bandages. So it's nice and fresh and there's no fluid building up within the bandages that are contained within these waterproof bandages, basically. So I kept everything super, super sterile, no infections, no problems, no complications, etc. And then I hope that this scar tissue, this little bit denser tissue underneath where the liposuction took place, will slowly be removed over the next couple of months. Again, that from liposuction, that takes a little bit longer than the gynecomastia surgery that took place. But I think this is pretty much healed, and I feel that I'm ready to go to the gym. Unfortunately, my leg is still a little bit swollen after the removal of the orthopedic plate. So I'm not really 100% comfortable walking around, especially lifting heavy dumbbells and barbells and that kind of stuff. So I'm just going to take it day by day from now. And then when I feel ready to go to the gym, I'll start with training chest, obviously. And this is what it looks like without the bandages exactly 2 weeks after the operation. You can see here my armpit that the incision site is almost unnoticeable. I would say it's maybe 3 to 5 millimeters across. It's already fully healed. I can see more of the irritation from the waterproof bandages than I can see the incision. So I'm just going to leave it as is at both sides. Here on the left side, that's also fully healed. Very small incision site that's fully healed, so no need for betadine or additional waterproof bandages. I think I can shower without them. But here in the nipple tissue, since I have a little bit of discharge still on the right side, I'm going to bandage that up as soon as we're done here, and then continue that for as long as I need until the discharge on this right side is resolved. And it feels a little bit safer wearing these protective waterproof bandages so I don't risk getting an infection later down the line. You'll see here that the incision underneath the nipple is very small, also fully healed. I might apply a little bit additional betadine here just to keep it sterile, especially now after touching it with my fingers, obviously, right? I've been washing my hands thoroughly, don't worry. And you see here on my lower chest that, well, the inflammation and the water retention and the scar tissue is just getting less by the day. You can probably see that also from the day-by-day progress pictures following the gynecomastia surgery and the liposuction that took place. So hopefully with time, this will just slowly get better so you can compare what it looks like right before the surgery and 2 weeks after the surgery. I don't think this is bad at all. I mean, considering I haven't gone to the gym for 6 weeks, not bad at all. Let's overlay this with the before front double bicep taken here on YouTube. And then I'll figure out in the post-editing process if there's any clear difference at all. For now, I'm pretty happy with the result. Again, the detail on my lower chest is still not where I want it to be, but hopefully over time, the scar tissue and the inflammation and the adhesions and all the kind of stuff with some active massage therapy and grass-on technique will slowly be resolved. So there will be a follow-up video a couple months down the line when everything is nice and healed and my body fat levels are a little bit lower. And then we can clearly see what the major differences is between previous diets where I got down to, let's say, 6-8% body fat, and then the follow-up diet a couple months from now where I'm similar body fat levels, and we can do some actual comparison. Okay, I'm going to put these waterproof bandages on because it feels a little bit safer, and then I'm going to record the rest of this video. So I ended up wearing this compression garment full-time for 5 whole days, 24 hours per day. They initially recommended me to wear it just for 3 full days and then wear it only at night, so let's say 12 hours out of the day. But I felt a little bit more comfortable keeping those sponges, which are already in the trash because I couldn't really wash those, so they were getting a little bit smelly. So I wore this for 5 days with the sponges 24/7 basically when I was going out and driving around on my motorcycle getting shit done. And I even wear it during the Lasik eye surgery as well as the orthopedic leg surgery. And then I switched to wearing this at night. And now I think 2 weeks post-op, I don't need to wear it again. So this one is basically ready for donation. I'll give it a good rinse and a wash. I have a spare one in case you're coming to Thailand or you live in Thailand and you're large and in charge around 100 to 110 kilos. Again, this is the biggest size and the other one is the biggest size that they have here in Asia. It's very tight, but that's what's required after gynecomastia surgery combined with liposuction, right? It needs to be tight for everything to kind of heal up. So if you're undergoing surgery in the near future, first come, first served, just shoot me a message on Instagram and I'll gladly send you over my compression garments because I don't think I'm going to need it in the near foreseeable future, basically ever. So today I'm exactly 2 weeks post-operation from the gynecomastia surgery and the liposuction. From a chest perspective, I'm eager and so ready to start training again. I have full range of motion. Here I feel a little bit stretching in the lower chest, right, where the liposuction took place, which again isn't a bad thing because I don't think I'm going to be doing dumbbell pullovers anytime soon because, well, look at these freaking lats. No need to do dumbbell pullovers. I should be able to do chest flies with the dumbbells, some sort of stretchy movement, right? Full range of motion. I don't feel the incisions pulling on both sides. So it's not really an issue. I should be able to go back to the gym and start training upper body again. But regarding the leg surgery, there's a little bit of inflammation and tightness and immobility that is currently taking place. So I'm just going to take it day by day and see how the leg is recovering, right? I can walk on it, no problem. They just removed the screws and the plates, but the bone is still fully healed. So I should be able to put some pressure on it while walking. I'm not allowed to train lower body for a month, and then I should take it really, really easy for the next 2 months. So it's about a 3-month recovery process. Again, by the time my daughter is born in the middle of this year, I should be fully healed from the leg surgery. But until that time, I just need to take it easy. And even while wearing a compression sock, the water that accumulates, the inflammation, is a little bit too much sometimes when I keep my leg vertical. So most of the day I keep my leg elevated unless I do a consultation or I'm recording video for you guys, right? When I sleep at night, I keep my leg elevated on an extra pillow. So all the water retention is slowly going away. And I remember from my motorcycle accident a long, long time ago in a galaxy far, far away that the edema and the water retention and the inflammation was absolutely terrible. I mean, my leg really looked like an elephant's foot and it was elevated, right, in one of those slings. So this time it's not that severe. The surgery wasn't as lengthy as that leg surgery following the motorcycle accident, but still there's a good amount of edema even when I wear a compression sock, which I have to put on very, very, very carefully to make sure that I don't rip open the incision site. So I think it's just an overworking of the lymphatic system. Again, I'm not being as mobile as before, right? I got a little bit bad reaction to high dose growth hormone because I wasn't really able to do cardio on the elliptical because of the surgery from the liposuction and the gyno surgery. And then, by the time I could do the elliptical, basically the next day was leg surgery and then I couldn't do anything. So now I'm a complete dad bod, being immobile, not doing much, keeping my legs elevated, playing video games when I have some time. So I decided to reduce the growth hormone and just keep the water retention to a minimal so I can deal with the edema and then do some mobility work of my ankle, just moving it around while I'm watching TV or when it's elevated. So here are the before and after x-rays for my leg surgery. On the left side of the screen, showing my right leg on January 17th, you see the surgical plate and 7 screws, and my bone looks completely mangled because I had a compound fracture, so they did the best they could. If you look at the top of the surgical plate, you see slightly that a little bit of bone is growing over that, so they needed to remove the bone from the surgical plate and then make that, grind that down basically to make it look cosmetically appealing again. And then on the right side again of this picture, showing my right leg on January the 23rd, so that's 5 days after the previous X-ray, the surgical plate and the screws are removed, leaving behind a little bit of an indentation and obviously 7 holes. So with those 7 holes, I shouldn't really be training. Fingers crossed that will kind of heal and the bone will come back together, strengthening the entire bone over the next month. And then as I start training again, obviously the bone mineralization and the density and the strength of the bone should progressively improve. Here's another angle where you can see how mangled everything is, right? You can clearly see the holes on the right side of my right leg. I had the 7 holes drilled to my bone. And that's what I'm going to have to work with for the next, for the rest of my life. So fingers crossed, this is all going to heal very, very nice. As you can see, the orthopedic plate is still in prime condition. Let me give you guys a close-up. So this has been with me for 18 years. It's got a couple scratches from removing you probably can't see that, from removing the screws. I have 7 screws. This is high-quality steel, high-quality surgical steel. So I think I'm going to make some jewelry out of that, maybe a bracelet or something like that, because, it's been with me for 18 years, which is longer than most things in my life. So might as well continue to wear it, right? I'll keep you guys updated what I do with this, because I think it was about $200 in total at that time, back in 2007. And if I drop another couple $100, I'm sure I can turn this into something nice worth wearing. Regarding the LASIK eye surgery, that was reasonably straightforward. First, I applied several eye drops to my eyes to measure the structure of the cornea and the eye and the tissue underneath to see if I was a candidate for LASIK eye surgery or if femto-LASIK eye surgery was a better idea, or compare that to PRK surgery. We decided on femto-LASIK eye surgery. Then they applied several anesthetic eye drops to kind of help numb the eyes and prepare me for surgery. The actual surgery was pretty brutal. I'm not going to lie, mildly traumatic. First, they shined the femtosecond laser in your eye to separate the cornea from the eye, following an incision around the cornea to kind of make a corneal flap. But when that happens, all you see is a hazy white. And then when they make the incision around the cornea and flap that over, all you see is blurriness. It's basically like an in real life 100% blurriness filter. And then for a couple seconds, you're wondering, is this going to be the rest of my life where I don't see anything? And then the excimer laser removes a microscopic layer from the corneal flap to help correct your vision and make it the best it can be. During that procedure, 11 seconds in my case, it literally smelled like burnt flesh, which is way worse than smelling burnt hair. After that procedure lasting only 11 seconds, they placed the corneal flap back on my eye. No need for stitches because apparently that heals and settles right away. Just need to position it in the correct posture. And then in that split microsecond before they switch over to the other eye, you can see 100% clear, but all you see is medical equipment. So I didn't really get a chance to enjoy it. All in all, the entire procedure took maybe 15 to 20 minutes for both eyes. But I was at the hospital the entire day to do the eye examination and provide aftercare after the surgery, which included some transparent shell-like protective shields, which they placed on my eye like this for an entire 24 hours. So you couldn't rub in your eyes. This was very annoying. So I saw very clear for a brief microsecond after the surgery, and then they put these protective shields on, and then you can't see anything again. Yeah, for 24 hours, luckily. Now, they put this on your eyes so you don't rub your eyes while you're sleeping. They gave me some diazepam, aka Valium, to take home, 5 milligram tablets. And they told me, just take this when you're home and then go to sleep. Now, I'm a little bit stubborn. Since the femto-LASIK eye surgery didn't really hurt at all because of the anesthetic eye drops, I was like, you know what, I'm just going to chill for the rest of the day, wear these goggles, and maybe do a little bit of work while looking to the corners because, well, work is always aplenty. And then once the anesthetic eye drops started to wear off, my eyes started to hurt really, really badly. Yeah, you really feel like you got punched in the eye just continuously, basically. So I took 5 milligrams diazepam and went to sleep for about 7 hours. Then I woke up to get another meal in. And then I took another 5 milligrams diazepam to sleep for another 9 hours. And then the pain was gone. But while I was waking up, going to the bathroom, yeah, the pain was pretty bad. Yeah, so the surgery is slightly traumatic, getting laser shined in your eyes and then having the surgical knife basically cut the cornea for the corneal flap. And then the pain that follows for 24 hours, nasty. But once I came back to the clinic and they removed this, you see like a hawk. It's honestly amazing. And what you hear worldwide for the large majority of people who do LASIK surgery, whether that's femto-LASIK surgery, regular LASIK surgery, or PRK, for the large majority of the people that don't have any complications afterwards, which again does happen, so please do your research. For people who don't experience complication, they say it's the best decision they ever made, and I can highly agree with that statement. So the next day after the procedure, I could basically see sharper than I could ever do with glasses. And then 6 days after the procedure, which was the day after the orthopedic leg surgery, I went for another checkup, which is basically a day earlier, but I was in the hospital anyway because I both did these procedures at Param 9 Hospital. 6 days afterwards, she said, you don't need these protective goggles anymore, these protective shields, because the cornea is completely closed and healed. And you don't have to use the antibiotic eye drops anymore, but feel free to use the artificial tears, regular eye drops, just to help lubricate everything, which again, I don't really do because I don't have any dry eyes currently. So sometimes you read online that people have long-term dry eyes. That's not the case for me. Maybe the lutein and the zeaxanthin or zeaxanthin is helping with that as well. Or I'm just a greasy bastard and my eyes are always moist. Okay, so right now it's 12 days after the Lasik eye surgery. Everything is healed. I can see like a hawk. I can highly recommend it. It's probably the best surgery I've ever done, even though also the worst surgery at the same time. So to close off the Gynecomastia segment of this video, I'll make a follow-up video at part 5 in the Operation Gyno video series to keep you guys updated on how the surgery went and once all the scar tissue and the inflammation and the adhesions and the bruising and everything is nice and healed and dandy and my body fat levels are nice and low again so we can see a difference, and then do some comparison pictures between previous good shapes where my body fat levels were low and you could see a tad hint, a slight indication of gynecomastia, but mostly having significant adipose tissue on my lower chest, blurring the definition and the separation and stuff. Compared to now, well, in the future now, basically. So stay tuned for that. Subscribe now if you haven't already, so you don't have to miss that video. All of the supplements I discussed, whether those are from Gorilla Mind or you can buy them over at iHerb, I have direct links for all of them down below, so you can save yourself 10% over at Gorilla Mind or 5% over at iHerb. Before I did all of these medical procedures, obviously I did extensive blood work, including checking my clotting factors, just to make sure that I wouldn't have any abnormal clotting or bleeding following the surgery, especially the leg surgery. That's a little bit more extensive than the gyno surgery, but the liposuction surgery, I mean, it's a pretty big area as well. So I did extensive blood work before the surgery, as you should when you do any kinds of surgery. If you live in the United States, you can check all of your blood work parameters over at Merck Health. And if you don't know how to interpret your blood work results, you can either schedule a consultation with me or use one of their healthcare providers, patient care coordinators, to help you stay healthy and get ready for these kinds of surgical procedures. Gyno surgery and liposuction, I did at Rothinon Medical Center, in the Fento Lasik eye surgery and orthopedic leg surgery, removing the plates and the screws. I did at Param 9 Hospital. You can find their links down below. I'm very happy with the service so far. I can highly recommend it if you have similar surgeries. And again, look for the same doctors, which is the doctors that I got the pleasure to work with. I'll keep you guys updated during the Vigorous Q&A. Fingers crossed, do a little prayer for me that everything is going to turn out fine. For now, for the Vigorous crew, a no gyno. Frontal blast for you guys. Much love, much appreciation, much thanks to your support over the last couple of weeks that was going in and out of the hospitals. Some of you guys were pretty worried because you weren't aware that I was going in for all these medical procedures willingly. So I highly appreciate all of your get well soon and best wishes messages. You guys are freaking awesome. And with that, I'm going to leave it here. Again, hit that like button if you haven't already, and we'll see you guys in the next video dropping soon. Peace out.